Here's something that might surprise you. When we talk about breastfeeding, we almost always focus on the baby. And yes, the benefits for infants are remarkable. But here's what most people don't know. Breastfeeding is equally a powerful health intervention for the mother. In fact, a 2024 survey found that only about a quarter of people were aware that breastfeeding can significantly lower a woman's risk of heart disease and diabetes. Today, we're flipping the script. I'm Dr. Fergal Armstrong, and this is MedHeads. Let's start with the big one, cancer protection. The evidence here is remarkable. For every 12 months a woman breastfeeds over her lifetime, her risk of developing invasive breast cancer decreases by approximately 4.3%. Now that might sound modest, but think about it cumulatively across multiple children and extended feeding. The data on ovarian cancer is even more striking. Longer durations of breastfeeding are associated with a 30% reduction in risk. We're also seeing emerging evidence for reduced endometrial and thyroid cancer risk. In my decades of clinical practice, I've seen how these kinds of protective factors compound over a lifetime, and breastfeeding is one that many women simply aren't aware of. Here's where it gets really interesting from a lifestyle medicine perspective. Pregnancy fundamentally alters a woman's metabolism, increasing blood sugars, elevated lipids. The whole system shifts to support the growing baby. Lactation appears to serve as what researchers call a metabolic reset. It helps return the body to a stable baseline. The high energy demands of milk production help re-establish glucose and lipid homeostasis. The result? Women who breastfed for longer periods show up to a 35% lower incidence of type 2 diabetes. Some analyses suggest a 4 to 12% reduction in diabetes risk for every 12 months of lifetime lactation. That's a significant protective effect that persists well into later life. Cardiovascular disease remains the leading cause of death for Australian women, and here again, breastfeeding offers measurable protection. A large-scale analysis of over 1 million women found that those who ever breastfed had an 11% lower risk of developing cardiovascular disease and a 14% lower risk of coronary heart disease later in life. We also see consistent links to lower blood pressure. When you combine the metabolic benefits with the cardiovascular protection, you're looking at a genuinely powerful intervention for long-term maternal health. So what's the practical takeaway here? If you're a new mother, an expectant mother, or someone who supports them, whether that's a partner, a healthcare provider, or an employer, understand that breastfeeding isn't just about infant nutrition. It's an investment in the mother's long-term health. Every month of breastfeeding contributes to a reduced lifetime risk of breast cancer, ovarian cancer, type 2 diabetes, and heart disease. And for healthcare professionals listening, this is an opportunity to reframe the conversation. When we discuss breastfeeding with patients, we should be emphasizing these maternal benefits just as strongly as the infant ones. The evidence supports it. Think of breastfeeding as a physiological spring cleaning after the major construction project of pregnancy, clearing away metabolic debris and reinforcing defenses against future health threats. If you find this useful, subscribe to MedHeads for more evidence-based health insights. I'm Dr. Fergal Armstrong, and look after yourselves.